is spring sports season, and the kids will be playing more sports outdoors and playing harder. And while you may think that sports injuries are just for older players, think again. Our sponsor, the Core Institute, says that there are many reasons why younger athletes are getting injured. And to learn more, we are joined by Dr. William Kesto, an orthopedic surgeon at the Core Institute. Thank you for being with us.
Well, thank you for having me today.
So first, let's start off by you telling us about the Core Institute.
Well, the Core Institute is a group of 8 board-certified orthopedic and spine surgeons. We treat everything from the neck to the foot, from arthritis to back pain, ligament and tendon injuries, and we offer a wide variety of surgical and non-surgical treatment options. So we come together as a team to create a best treatment plan for each patient's lifestyle and goals.
Okay, so let's get into a little bit more detail. What are some of the more common ways and reasons why younger athletes are getting injured?
Right, these younger athletes more commonly are injured from overuse. We know that 70% of young throwing athletes between the age of 9 to 18 complain of arm pain. And this can be as simple as a tendonitis that gets better with a few weeks of rest and therapy, or a more serious ligament or tendon tear that requires surgery. And this is happening more because of a lack of rest between games. And they're going out there throwing with an already injured or fatigued arm. And so the body doesn't have a chance to do its job and heal. And something minor becomes something major, and they lose playing time.
Wow. So now here's another question that a lot of people have. Should younger athletes focus on a single sport all year?
That's another great question. The simple answer is no. We know that single sport athletes are 5 times more likely to suffer an injury that requires surgery. And that leads to a loss of playing time while they recover. And it's especially true for those athletes that spend more than 8 months in a single sport. So we encourage multi-sport specialization or participation in order to give the body time to heal. For example, going from baseball to soccer. And that allows the entire body to develop full muscle strength and conditioning.
Okay, that makes a lot of sense. That makes a lot of sense. But when they're out there and injuries do happen, what types of injuries do you see?
Well, we're talking baseball, we're talking throwing injuries. And so, the most common things, at least for the shoulder, you're going to hear that common, the rotator cuff tear. Everybody's heard of that. There's also tendonitis, and there's injuries to the cartilage of the shoulder known as the labrum. In the elbow, we also see tendonitis, and there's a ligament injury. And this sometimes leads to a procedure that's familiar called the Tommy John surgery. Now, what's different is we used to see this more in older professional athletes, but now we're seeing it more and more in younger athletes. And you got to think of it this way. These tendons and ligaments are like a rubber band. And in these young athletes, they're not fully developed enough. And so it's only a matter of time when you stress this enough and it snaps. And then they need surgery and lose playing time. And so, this is where we encourage appropriate rest and condition.
Okay, now, what though are some of the signs of a more serious injury that may need a doctor's attention? Because sometimes kids just want to shake it off and give it some time to rest. But when should they come and see you?
They do, and they enjoy playing these sports and being with their teammates. But it's very important for the parents and the coaches to look for these signs. And that's basically going to be, where they have so much pain they can't participate in their sport and it's affecting their activity. Or for throwers, they're losing velocity or they're noticing weakness. Definitely come and see us if you have a lot of swelling in the joint or clicking or popping from the shoulder, or if there's a contact injury between 2 players. Those are the times you need to come see an orthopedic specialist.
Okay. Now we're just about out of time, but please let us know how many locations you have in Metro Detroit.
Thank you. We're located in Novi, Southfield, and Brighton, and all of our offices have physical therapy and digital x-ray.
Well, excellent information. Thank you so much for joining us.
Thank you for having me.
The Core Institute specializes in treating orthopedic and spine conditions. To see all of the treatments offered options they offer, find the location nearest you, and to schedule an appointment, visit the website, thecoreinstitute.com. Again, that's thecoreinstitute.com.